tell you about our upcoming joint health conference on September 14th and 15th and 16th. We're getting ready to do this amazing event to be able to talk about joint health and joint disease and how to really prepare for the long life of someone living with a bleeding disorder and how to really have the healthiest joints that you could possibly have through adherence to your treatment regimen and also through education for being the best advocate for yourself that you can be. And I'm really excited about this weekend. We have some phenomenal things coming up that I cannot wait to get a chance to dive into, such as some amazing sessions. We've already interviewed Dr. Claudio Sandoval, who's going to be talking about revisiting the physiology of bone and joint health in hemophilia A. He's going to be talking about the factor VIII functions beyond the coagulation. And also we've got other people like Dr. Amber Frederizo, who's going to be talking about women with hemophilia A and the new paradigm there. Lots of amazing sessions are going to be happening. I'm super excited to get into all of that, but you can register for this event online at our website at hope-charities.org, and you can click right there on the link, and it will get you access to all of the Zoom links where you can join these live sessions and be a part of the discussion and really ask questions to our expert presenters and get to know more about this idea of keeping your joints healthy. And I'm really excited to have this conversation. So definitely check out the website. You also will be able to be entered into a chance to win some amazing raffle prizes. We're giving away gift cards and even a grand prize of a 2-day trip to Key West. That's amazing. I want that, but I'm ineligible. There you go. But anyway, I'm excited about this great event and hope that you'll join me for this live event. But today I have invited Kevin Griggs to join me into the podcast to talk a little bit more about this idea of joint disease and joint health. And Kevin, it is great to see you. Thank you so much for joining me on the Hope podcast today. It's great to see you.
Well, thanks for having me.
I am really excited about this topic. I know that you are as well, and there's so many good things going on, but I wanted to just kind of dive right in. I know you're part of the Octapharma team and so many great people over there who've been so gracious to sponsor this particular weekend. But for folks that might not know you yet, I'd love to kind of dive in just a little bit and talk about where are you from and what is your role within the Octapharma ecosystem?
Definitely. Well, thanks for having me again. So I'm from Southern California, born and raised. So I work remotely for Octapharma. I've been with the company for about 6 years now. And my role in the company is I am the Associate Director of Medical Affairs for the Hematology Group, where we specialize in scientific exchange with providers, pharmacists, physicians, nurses, social workers, etc. Within the healthcare field.
Wow, that's incredible. And you have a background as a pharmacist and a deep development in working with these types of investigations over a lot of other disease states besides just hemophilia. Isn't that right?
Yeah, so I started off in the HIV space. I was a investigational drug pharmacist for a company producing an HIV antiretroviral drug, as well as the pharmacist of record for an NIH-sponsored HIV vaccine clinical study. I was also then recruited to Octapharma and have been here in the hemophilia space for the last 6 years. So it's been a great transition.
Wow, that's incredible. Well, we sure are glad to have you and a part of the hemophilia community. And I guess that kind of leads me right into my next question, which is, what is it that you've been around the community now for a number of years and you've seen a lot of things already change in just the short time that you've been invested with this community. But tell me a little bit about what inspires you so much about people with hemophilia and other bleeding disorders.
What inspires me about the hemophilia community in particular is its resiliency and its ability to advocate for itself. As we all know, the hemophilia community has gone through some tough times over the years and have been severely impacted by contaminated products, drug shortages, etc. And what inspires me is that this community continues to move forward, continues to gather together as a group, understanding that there is strength in numbers, and really to set the tone for yourselves to say,
Mhm.
this is how we'd like to be treated. And we're gonna advocate for that, whether it's legislation, whether it's advocating in the community, whether it's communicating with physicians. I mean, that's one thing that really sets itself apart to me about the hemophilia community.
That's so true. Had the pleasure. I've sit on the Rare Disease Council in our state and had the pleasure to work with a lot of different disease states. And that is one of the things that continues to resonate with me as well, is that we really are a resilient community. We're a community that really does fight for each other and really stays in the forefront of where there needs to be change. We try to advocate for that. And even with that said, I still feel like that I've seen a lot of this younger generation, especially, coming along and actually not being maybe quite as educated on the products as maybe we once were, 25 years ago. And so, there's been a lot of changes throughout the community. So I'm just curious, as far as your perspective from a professional in the community, you've seen a lot of things change on the investigatory side. I don't even know if that's a word, probably just made it up, but
Yeah.
and seeing what's happening there. You've been on the front lines of some of that type of connection, and even how the physicians are seeing that. What do you see happening in terms of, the patient population really owning, and of course this weekend with us talking about joint health, really getting to the knowledge that they need to do exactly what you just said, to be empowered? I mean, do you think people are getting the information they need, or do you think these are moments that they need to be plugged into?
Well, there is so much information out there, and I hate to say it, but I think that with so much information and so much access to great products and great treatments, people can tend to take things for granted. Um, we often forget how hard it was when there weren't many products and there weren't many options available, and there weren't many studies that were done. And I think it sometimes can get to the point where, hey, they think that this is just normal. And you can take for granted the fact that, no, we really have to continue to fight and continue to access the information, to advocate for the information, and to disseminate the information that's already out there to achieve better outcomes. Because that's what we're looking for at the end of the day, right? We have so many choices and so many things available for us now. But the at the end of the day, what we're looking for is better outcomes. And in this particular case, we're looking for better joint health and joint mobility and joint stability. These are the things that we don't want to take for granted.
Yeah, it's so true. It's so true. Do you see how, or do you feel like you've observed adherence being an issue as it relates to people experiencing joint disease or having problems with their joints with hemophilia?
Well, definitely, I've seen it. I've seen it kind of trending up where there is a little bit more um, joint disease than it should be. I mean, there were some benchmark studies that show that with proper prophylaxis, with adherence to that prophylaxis regimen, that you can definitely prevent joint disease, joint damage. You can keep the range of motion in your joints, and again, like I said in the previous answer, you don't want to take these things for granted. Once you start to lose the mobility in your joints, um, then you really realize, hey, this has impacted my life in a serious way.
Yeah.
So I totally agree with that statement.
Yeah. I think it's one of those things where it's like the human element to what we're doing here. Sometimes, if you look at it in isolation in a test tube, sometimes this thing can be exactly perfect, but then you put it out in the wild and you find out that you have a totally different set of results, because it really does require the vigilance of the individual to be fighting for that every single day over a long period of time. And to your point, when you have joint disease sets in, or joint damage of any kind, it really, you can't get that back. There's no alternative joint that you can, even a replacement or so on, is just not as good as the original. And so we really, in this community, especially with bleeding disorders, you have to be really, really, really vigilant to be able to stay and keep adherence to your doctor's prescribed treatment regimen, because it's really vital, which is one of the things I'm so excited about this topic. I know you know a lot of the speakers firsthand. You've had a lot of experience with those guys. Any tips for us? Any sessions you think that we need to make certain we look out for through this weekend?
Well, I think that there's going to be a great lineup of speakers. I've heard pretty much all of these speakers speak on various topics. You're definitely going to get an engaging and a very educational session on how to protect your joints, on how the basic physiology of how to make sure that you're adherent to your medication so that you can prevent joint damage. You're going to learn a lot here, and I'm excited for all of you to learn more about this.
Well, I certainly appreciate you saying so, because I couldn't agree with you more. I'm getting so fired up every day, and look forward to some great sessions. But Kevin, thank you so much for joining us today. Thanks for all you're doing on the research side and helping us push the ball forward, because I do think there's a ton more that needs to be done there. I know you're working hard on that end, but thank you so much for all that you do, and we'll look forward to seeing you sometime in the near future.
You're very welcome. Take care.
All right. Wow, that was so great. Look, just as Kevin said, you need to make certain that you sign up for our joint health conference coming up. There's still plenty of time to do that. It's going to be on September 15th and 16th. You can go right there to the website at hope-charities.org, and you can register right there on the website. It's going to be a great time. And even if you can only come to one session, just still register. You'll get all of the links, and you can just choose the one that fits inside your schedule the best. But these sessions are going to be packed full of great information with some amazing experts who'll be able to tell us lots and lots of great information to help keep you on track, keep us educated for the right things to have the right outcomes, right? You got to do the right things long enough to have the right outcomes. So let's keep it going, keep it excited. If you have any questions, just shoot us an email at events@hope-charities, and we'll look forward to seeing you very, 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 very soon. Take care.